that is possibly 3 times that of the general youth population. Shaheda Omar, Assalamu alaikum, welcome to the program. Okay, Shaheda, I can't hear you at all. You sound terribly, terribly distorted. Let us try and please Can you hear me, Shaheda? Okay, I can't hear you at all. You are very distorted. Can you hear me now?
I can hear you, but can you hear me?
Okay, you've just come through clearly now. Thank you very much. Did you hear my opening statements, Shaheda?
Yes, yes.
Okay.
So,
Uh, yeah, and then the one question you're going to respond to my opening statement, which comes first, the mental health issues, pre or post the detention?
so I think it's important to understand that we are speaking about children in conflict with the law, and they fall under the Child Justice Act. And the whole ethos of the Child Justice Act looks at restorative justice, looks at diverting children away from the criminal justice system. So when we look at mental health, these children are actually or have to undergo assessment, preliminary assessment by probation officers to assess their mental health, to see if there are any mitigating circumstances or there are any contributing circumstances, but also looking at the levels of risk. Have they committed Schedule 1, Schedule 2, Schedule 3 offenses? And on the basis of that, it will then be decided, recommendations will be made whether they need to receive immediate psychological and psychiatric administration and if they need to go into a residential facility. You alluded to the fact, we refer to the child youth care centers. Now, children, these are secure care facilities, children who may have mental health problems, but also who have committed Schedule 2 and Schedule 3 offenses. So mental health, of course, has to take priority, but at the same time, one needs to consider the risk factors, the safety of the offender, and the safety of society in general. And on the basis of that individual would be institutionalized, receive intervention, support, therapeutic support, and of course, ongoing monitoring and supervision.
So, Shaheda, I'm kind of wondering about when we look at juvenile delinquents, they perpetrate crimes, minor crimes, whatever it is. Some of them at a very young age are already experimenting, are already involved in substance abuse issues, and that is why they land up in these facilities. And whatever their backgrounds might be, broken families, that's a discussion on its own. But let's look at the scenario while housed in a juvenile detention facility. I'm not quite sure how geared up we are in South Africa regarding this issue, but undoubtedly minors will often suffer trauma that they possibly would not experience outside, which would include bullying, physical assaults, and threats. How does this further impact on their mental health?
Well, there are risk factors within the facilities, but I think the public needs to be aware that these kind of institutional care and facilities are also monitored and evaluated regularly by government departments. So it's Correctional Services Department of Social Development, Department of Health. And of course, we find that within the institutional facilities, the youth and, as you've described, delinquents, children who are in conflict with the law, act out, because we need to also understand that they are all put together in a melting pot, coming from diverse backgrounds, coming from backgrounds of adversity, different forms of adversity, whether it's substance abuse, dysfunctional families, absent father figures, exposed to violence, and a history of victimization. So often these children going into these facilities and committing these crimes are often presenting low self-esteem and, it's depression. But what we see is not the sadness. The sadness is actually shrouded by aggression, where they display a high level of aggression. And in order to feel some sense of power and control, their lives are in a state of chaos. And how do they try and assume or, a maladaptive behavior that they resort to is by not asserting themselves. Well, they think they're asserting themselves, but they're actually being, they are aggressive and bullying. And of course, it's also because of the low self-esteem, you would find that they form cliques within these facilities. And, internally, these cliques are also all about the dynamic of power, the dynamic of taking charge of one's life. And the way it impacts on people's mental health will certainly have negative effects. So if a child is already affected by previous adversity, there might be further signs of depression, anxiety, antisocial personality disorder, and one could go on that there would be many, many other manifestations of poor mental health conditions. But we also need to actually give some credit to these facilities because they have a multidisciplinary team approach. They are social workers, they are psychologists, they are psychiatrists, and they are, medical health practitioners that are also overseeing the interventions and providing an oversight in terms of support.
When you talk about these facilities, Shaheda, undoubtedly being the clinical head of Teddy Bear Clinic, you must have visited some of these facilities during your career. And you do speak from a position of authority. And I'd like to hear that you're saying, as you've indicated, you have a multidisciplinary approach there with all of these high level clinicians or specialists dealing with these children or these young adults. Also, when you talk about low self-esteem and the different backgrounds that these youth come from, once they're inside, it's really about survival of the fittest. And I should imagine whether it's done kind of under the radar, you also have some sort of gangster mentality playing out there, or these youngsters aligning themselves to whom they believe will be protecting them. So all of this
Indeed.
also plays out in these facilities. And then my final question to this, in this train of thought is, we often hear of people being incarcerated. I'm talking about adults, and then we are told that they come out being more hardened than they were before going in and serving a jail term. Would it be similar for youth and adolescents that are in juvenile care facilities?
So, Julie, you made a very valid point, a strong point regarding the adult perpetrators or offenders coming out more sophisticated in their modus operandi. And that is why the Child Justice Act is in place to prevent and overcome that kind of repetition of the cycle of violence, where we speak about diversion programs. So they would actually undergo specialist intervention programs within these facilities with the opportunity of restorative justice. So with the multidisciplinary professionals getting all that kind of support, whether it's intensive one-on-one therapy, group work therapy, but also bear in mind that opportunities created for further education, growth, and development. I have visited these facilities. You are absolutely correct. I've visited in the East Rand, in the West Rand, in Pretoria. So I'm quite familiar, and even looking at Leeuwkop prison, the juvenile prison. So these facilities, having visited them, I can say with a level of confidence that the physical environment is conducive to the well-being, pursuing the mental health, the physical health, opportunities for sport and outlet, recreational outlets. So in terms of that, and even in terms of in relation to education, advancement of education, there are opportunities. And if we look, you actually spoke to statistics, but I also want to say children that have gone through, or youth and adolescents that you have alluded to, who have gone through these rehabilitation facilities and institutional settings, have those that have been released have actually shown a positive outcome where they have not committed, or they haven't, there hasn't been recidivism, reoffending. So there is hope. I think we need to actually look at the positive side of it. Those with the Schedule 3 offences and who have underlying pathologies continue to remain in institutional settings. But when we speak about hardened criminals, I think the Child Justice Act is always, when working with youth and adolescents, the focus is on how to prevent them from becoming hardened criminals. And the incarceration where previously children were placed in cells with adults, everybody was put together. This is quite, it's actually, there's a strong separation, and the approach is very different with youth and adolescents. That it's more supportive environment, but at the same time holding them accountable for their actions, understanding that there are certain things that they have to go through. So the kind of interventions that they focus on is on relapse prevention, impulse control issues, because that's one of the pressing issues where they're unable to restrain their impulses, but also conflict resolution, anger management, and I could go on. So with a high level of confidence, yes, many of them may give in and may suffer further in the institutions, but there are many who have actually shown positive and desired outcomes when they've been released. But remember that they have social workers assigned to them, probation officers, and they are monitored and they are evaluated at different periods. And if they do not show a favorable prognosis, they will not be released from these detention care facilities.
Dr. Shaheda Omar, a clinical director at the Teddy Bear Clinic, thank you indeed for shining a positive light on this very concerning issue, and that is mental health concerns within juvenile justice. Always a pleasure talking to you. Go well and keep us in your du'as, inshallah.
Inshallah. Wa alaikum salam wa rahmatullahi wa barakatuh.
It is exactly 9:05. In a minute, we'll be joined by our news editor, and that's you, Zai Jadwood. Please stand by. We'll cross over to your desk and you can share the news bulletin of the day with us right here on News and Views.